My name is J.T. Abraham. On 16th February morning while I was driving, I was having discomfort all over the body. Especially I was having a slight chest pain, and then I was sweating also. In Salmaniya Medical Complex, I was given thrombolysis, and then I was admitted for 4 days, and then I discharged. They have asked me to do the angiography as soon as possible. After discharging from Salmaniya, I was looking at options of going back to India or doing the angiography and angioplasty required here. I came to know that BSH has started cardio clinic in association with Apollo Hospital. So I came here and consulted Dr. Abdulaziz. I came after 2 weeks of discharge from Salmaniya. There are very less options in Bahrain. One is PDF and here in BSH. So I have other friends also saying good about this hospital. So I thought I will come here and check. Dr. Abdulaziz. Initially ECG as well as echo was done, and then doctor said we have to go for the angiography. So angiography was done, and then angioplasty is also done. Doctor said there are 3 blocks, okay, and all the 3 blocks can be dealt with stents. Doctor said there are 2 options. One is bypass surgery. The other option is to use the stents. Bypass surgery is going to be more complex, whereas stenting is an easier job. I can get discharged in 2 or 3 days time. So it is a very simpler solution to the issue. So I thought I'll go for stenting. It was done from hand. I was conscious. It was very cool. It took around 35 to 40 minutes. Yeah, the stay in ICU was very good. It was for 2 days. Okay. The sisters, everybody was very nice with me. Yeah, I feel very good, comfortable.
Hello everyone. We have another interesting case today that we'll discuss. This is a 49-year-old Indian gentleman. He is a known case of hypertension for the last 3 years. He suffered from an acute heart attack about 3 weeks back. He was admitted at Salmaniya Medical Center where he was immediately thrombolized. That is, he was given a clot buster injection and he was kept in the ICU for 4 days and then discharged. Post attack, he continued to have some angina and he came here for an angiogram. When we did the angiogram, we found, to our surprise, multiple blocks in 3 arteries. So one artery was the left anterior descending artery, the LAD, the other artery was the LCX, and the third artery was RCA, which showed all critical lesions. The peculiar feature in this patient was that the right coronary artery did not arise from its normal position, but it was high up and posteriorly arising. So we had to use a special catheter to engage that artery and complete the angiogram. So the angiogram revealed a 90% lesion in the right coronary artery and an 80% lesion in the left anterior descending artery and a 70% lesion in the left circumflex artery. Now, given his history of hypertension and this recent MI, so he needed immediate revascularization, and he was given both options. Bypass surgery versus multiple stents for the 3 arteries. And we also discussed this with our heart team, including the cardiac surgeon Dr. Ramana and cardiac anesthetist Dr. Devinder and our clinical cardiologist Dr. Prashant. And then we decided that he can benefit from PCI with stenting. The family was counseled about this and they also agreed for the same. And he underwent the angioplasty. So 3 drug-eluting stents were put in these 3 arteries, and then was kept in the ICU for 2 days and then discharged. All the procedure was done from the right hand, and so it was very comfortable for him. And he's come for the follow-up today, and he's doing extremely well. And this case also goes on to show that multi-vessel disease can be treated with either CABG or PCI, and careful patient selection is important in order to improve patient outcomes. So this is the angiogram of this patient, and here we can see this is the left anterior descending artery. It has about 80% lesion here. This is the left circumflex artery. This has a 70% lesion here. And the same thing can be seen in other views. You can see the lesion here and here. And the interesting part about the right coronary artery was that it was arising from an anomalous location. So this is, as you can see, it is not arising from the normal location here. So we had to use 2 or 3 different catheters to be able to engage this artery. And then we were able to hook it with what we call as a multi-purpose catheter. And then you can see the other peculiarity about this artery was that it was ectatic, in the sense it was more enlarged than the normal segment. And you can see a very tight blockage here. So after the discussion with the heart team and with the patient, we decided to go ahead and do angioplasty to this artery. So this is the angioplasty, this is how it is done. So we engaged with a multi-purpose guide, a wire is put in into the right coronary artery, and then we had to dilate it with a balloon so as to create passage for the stent to pass. This was the balloon dilatation, and after the balloon dilatation you can see the flow is established. Good flow is established, but there is a very tight stenosis still remaining. So we put in a stent here because this size of the artery was big. It was a 4.5 millimeter stent that we had to put, and then in order to match it with the distal segment, we had to dilate it with a larger non-compliant balloon. So a post dilatation was done with a non-compliant balloon, and this is the final result of this patient. You can see very nicely flowing right coronary artery with good distal flow and well opposed stent. Then we came to do the left anterior descending artery. So this is the same procedure. The wire is passed in, and then you can see a very tight lesion here in the left anterior descending artery. This was directly stented with a drug-eluting stent, and let me show you. This is the actual stenting. The stent is expanded very well, and then you see the result. So very well expanded stent with good flow achieved. And then we came to the third artery. The third artery is showing about 70% lesion. A wire is passed in and the direct stenting is done. This is the stent expansion, and this is the final result after all the 3 stents are put.